Thank you. Thank you, everyone, for being here today. I'd like to start by acknowledging that we are on the lands, the treaty lands of the Mississaugas of the Credit First Nation, and lands that are covered under the Treaty 13, the Between the Lakes Purchase. I reaffirm the Ontario Green Party's commitment to the truth and reconciliation process, which is vital to combating colonialism and systemic racism. Today, I'm joined by Jean Hopkins, manager of Wellington Guelph Drug Strategy, Ingrid Oles, Consumption and Treatment Service Support Coordinator at the Guelph Community Health Centre, and Michael Parkinson, Director of the Drug Strategy Network of Ontario. Earlier this week, the Ford government passed legislation that would officially close the supervised consumption sites in Ontario. In the midst of an opioid and toxic drug crisis, with the stroke of a pen, they signed the death sentence of the tens of thousands of people who rely on these sites to stay safe. Yesterday, the Auditor General's report revealed that the decision to close the supervised consumption services was made without proper planning, impact analysis, or public consultations, and concluded that Ontario does not have a plan in place to respond to the opioid crisis. The government is leaving our neighbors who use drugs to fend for themselves. It's cruel and unjust, and it's going to make our communities less safe. With that, I'll turn it over to Ingrid, who will share a few words.
Hello. We are talking a lot about value for money today. As someone who has lived experience with using services and now works in the CTS in Guelph, I think it's important we also talk about other kinds of value, like the value of accessible, compassionate care to people who can't find it anywhere else. I have lost more friends than I can count. When it's been a while since I have seen someone come into the space, it's always stressful because I worry they have passed away. Shame is a huge factor for someone who uses substances. It's not easy to ask for help. Peers or other people who have lived or living experience are some of the best supports as a first point of contact. I personally had the same family doctor since I was a child. The shame and guilt I experienced from my own substance use was a barrier that prevented me from accessing the care I needed. The CTS is a place where people can come to feel safe and accepted. That is a huge step on the path to creating trusting relationships. For a lot of people, it's the first step to feeling safe enough to seek out health care. The CTS provides wraparound supports that are so meaningful to our community. Sometimes we start with wound care or by providing clean and dry clothes. We provide many supports to help people stay out of crisis. Everyone who comes in is welcomed with the same compassion, care, and respect. CTS workers are grieving every day, but we work hard to provide the most accessible supports possible. Some days feel even harder, as many of our visitors tell us they are feeling hopeless, knowing that soon these services will no longer be available. Multiple systems have failed individuals that we support. Childhood trauma, abuse, trafficking. Too many of our visitors are told they are unworthy of health care and that they don't matter. When someone is homeless, it makes everything harder. Substance use, wound care, and other health care is even harder to navigate. The CTS is a welcoming environment that says, you are worthy, we care, we will support you in your journey to find options that will work best for you. We help them one baby step at a time if necessary. Every month, our community is losing friends, parents, and children. Cutting the services that connect individuals to support is not the right answer. We need more avenues, more options, not fewer. Without the CTS, we can expect more wellness checks, more emergency room visits, and more division in our communities as others are also waiting for health services. Since I have stopped using substances, they have become even more deadly. Xylazine, benzos, and more are in almost all of the drug supply. Narcan does not reverse these substances, but thanks to the knowledge of nurses and other workers in the CTS, we are still saving lives. Without the CTS, emergency rooms and ambulances will deal with the overflow. Without the CTS, people will die, and these deaths are preventable. Recently, at the Guelph CTS, a client brought in a friend who was looking to get support. The client said to them, "This is where you can feel safe, and this is where people care." CTS services are low barrier. They are a starting point for people to access healthcare, mental health, and addiction support. And of course, there's value in that. Thank you.
Good morning. My name is Michael Parkinson. I'm with the Drug Strategy Network of Ontario, and the network is unique in North America. We are comprised of members with experience and expertise in drug-related issues from Northern Ontario to the south, to the east, and to the west. And we take a sort of a four-pillar approach to resolving the drug poisoning tragedy that now affects every community right across Ontario. So we're interested in efforts in prevention, in harm reduction, treatment, and community safety. The network was deeply disappointed by the move from the government to defund consumption and treatment services in Ontario, and are worried that it resembles more of an opinion-based decision-making process rather than one that's rooted in evidence and the wisdom of communities. We are submitting a value for money audit request because we firmly believe that there is a net benefit to all taxpayers, whether people are using substances or not, by having consumption and treatment services in place in communities. We expect that the burden on municipalities and taxpayers more broadly means more money for less value. And we know that the government has received internal advice from staff and from legal counsel that an improper risk, there was no risk assessment done, and the full expectation is that we will see a clogging of emergency rooms, 911 emergency calls, and more. Yesterday, we heard the Auditor General speak to the very same points with the expectation that those health services will get crushed as they attempt to mitigate the offloading from consumption and treatment services. So we expect most of the value would be found in the healthcare system. So, anytime you can prevent a case of HIV/AIDS or hepatitis C translates into millions of dollars of savings for Ontario taxpayers. Anytime you can divert people from the criminal justice system is a huge saving for taxpayers. And we've seen evidence that CTS sites both prevent and treat HIV, hepatitis C, and other health issues. We've also seen evidence out of Toronto, out of Guelph, out of Kitchener that in neighborhoods with CTS sites, there is less crime relative to the rest of the city. And finally, it's a crisis already in many communities right across Ontario with respect to getting an ambulance when you need it. So we are concerned that someone may be having a cardiac arrest, they call for an ambulance, and because their community is in a code red or code yellow situation, that ambulance will not arrive. And we're aware of some municipalities where the recommendation is to increase taxes to help offset the burden of treating overdoses by paramedics, those that are currently handled by CTS sites right across Ontario. So at the end of the day, we're expecting more costs for taxpayers with far less results. And on behalf of the Drug Strategy Network of Ontario, that's why we're submitting this value for money audit request. Thank you.
Thank you. We're able to take any questions you might have.
Your site in Guelph, just to be clear, is it one of the 10 that is slated to close?
It is.
Okay. Is there any way your facility could keep operating if it just stops providing the safe consumption service there? Can you keep providing those wraparound services, or do you think you'll have to, like the other services in terms of referrals, or do you have to completely shut down?
I'm going to turn this over to Jean at the Drug Strategy. Should be able to talk more about that.
Yeah, thank you. That's a great question, and the short answer is we're in a period of transition right now, and we really don't know. In Guelph, we have applied for the Heart Hub, and we're waiting to hear back to see what the status of that is and what that looks like. Certainly, everybody in our community is absolutely committed to making sure that harm reduction services are still available, in addition to the Heart Hub model. But at this time, we're like I said, in a period of transition, and there's a few unanswered questions as to what that's going to look like for our community. But we do know that there will be harms, and there will be really significant impacts as a result of the closure. So we're doing what we can also to mitigate some of the potential harms in the coming months.
Have you had any of you really contact with now staff from the minister's office, or has there been consultation now? We know there wasn't much before they announced this decision. That was one of the AG's findings yesterday, a lack of consultation. But the minister yesterday said they are consulting with stakeholders. Are you one of those stakeholders? Have you talked to her or any contact with the ministry?
Yeah, so the announcement by the health minister at AMO in August blindsided everyone. There was no consultation, and in the AG report, there was no analysis of the risks and benefits of eliminating CTS sites. So it's not just 10 sites that are expected to close. It's every CTS site and then some other consumption sites in Ontario. The ministry has been in touch with individual operators of CTS sites. So they've been directed to wind down operations. That was a few months ago, and to transition into something else. To your earlier question, there is no substitute for a supervised consumption service. It is not the hard hub. It is nothing else. They are unique and they are fantastic at what they do. Primarily because, and you heard Ingrid talk about some of the folks who will come in there, it's a safe place to use currently illegal substances. And that doesn't exist anywhere else. And so whether people are, managing withdrawal or for whatever reason they're using substances, a decriminalized environment makes honest conversations possible and fruitful relationships possible. So that could translate later into an off-ramp or into something else. But to your question, no, there is no substitute for a supervised consumption site, and any transition plans are about shutting the doors and the hard hubs. I mean, that's great. That's 375 maybe subsidized units across Ontario for the 19 successful sites. It's still a drop in the bucket, but I think every municipality welcomes additional funding to help mitigate this crisis. And if I could just say one more thing, this is a raging public health emergency of historical proportions. Ontario has never witnessed this kind of carnage before. So since this government took office in 2018, more than 22,000 people have died from drug poisoning. Most of those are preventable, and that's why we're concerned about the closure of the CTS sites and the additional prohibitions on municipalities around decriminalization initiatives, around safe supply initiatives that help stop that carnage and help stop people from maybe accessing expensive and too late emergency departments, criminal justice systems, that kind of thing.
The minister mentioned when she was talking about consulting with stakeholders, she says that they're listening to families, that they have heard from parents who don't take their kids to the playgrounds because of the needles. What do you say to those families that she says she's hearing from that don't want these CTSs in their communities and say that they're dangerous?
So I live in Kitchener, and I can tell you in my community, that is simply not true. What the minister has indicated is not borne out by reality in Kitchener-Waterloo. So, for example, the daycare across the street from the CTS is openly worried about the closure of the site. They're worried about an increase in drug debris. They're worried about a child or a parent witnessing someone in medical distress or dead. And they're worried about, there is nowhere else for people to go. And so when the minister says people will not die, that is absolutely not true. People will die, and they will die fairly quickly after CTS sites close in Ontario. We have some anecdotal experience of other services where that has happened. And when the minister says that families and children are concerned, I don't doubt that's true, but CTSs make things worse, not better, and I think that's really the bottom line at the end of the day, because the people, the hundreds of people, better not worse. Sorry, did I say?
I won't use that clip. Don't
Yeah.
Mr. Schreiner, if I could hear from you, Mr. Schreiner, maybe can you just speak a bit to the speed with which this legislation was passed and how that all played out?
Yeah, it's very disappointing that the government didn't take the time to actually listen to the people on the stage with us today. I think what I've heard from a lot of folks is we don't need either or solutions. We need both and solutions. We need CTS sites and harm reduction. We need heart hubs and more supportive housing with wraparound services. In my own community, the city of Guelph has increased the budget for paramedic services now by $500,000 because of the anticipated closure of the CTS sites and the additional pressure that's going to place on paramedics and our healthcare system. And so I just would really plead to the government to listen to the families and people being affected by this decision. Listen to our community that are concerned about the health and safety of our neighbors, and stop having either or discussions, and let's start having both and discussions to provide the healthcare services people in our community desperately need. Unfortunately, the government didn't take the time to hear that from people and communities because they rushed the bill through so quickly.
Just to be clear, like they invoked time allocation, correct? They did not
Oh, yeah.
hold any hearings at committee. They just skipped that whole step.
Yeah,
Can
they
you
just
like sort of explain that a bit more.
Yeah,
how,
sure.
How a bill normally is passed and what they did in this instance.
Yeah, so normally a bill has 6.5 hours of debate, and then if it passes second reading, it goes to committee, and oftentimes it's at committee for multiple days. So many people can come to the legislature and talk about how the bill affects them, maybe recommend changes to the bill, talk about ways to improve the legislation. None of that happened. They rushed it through in a matter of days when legislation usually takes a week or two because we take the time to listen to people. I think that's part of our job as MPPs, and all of that was skipped with this bill.
Okay, just my last question. The minister talks about with heart hubs, you know, that she envisions them providing everything from social services to healthcare to pathways to addiction treatment and recovery. Do you have a sense of what she actually means by that? Does that mean referral to treatment beds in hospital, new beds? Like where are these pathways going?
Well, it would be great to have some dialogue with the health minister and other folks in advance of the heart hubs. So I think each, these will be up to 19 funding for up to 19 communities. So our understanding that north of 80 applications for those 19 spots have been received, and what happens in each community will look a little bit different. There's a bit of a focus on homelessness, and maybe some focus on people living with addictions, right? So it'll provide a few rent supplements, no new builds. It'll provide some opportunities for to hire some people to provide some of those, maybe some of those direct services or referrals out. What we know in Ontario is that if you're looking for addiction treatment, you're on a wait list for assessment, and you're on a wait list to get into an inpatient or outpatient program. And that wait list is measured in weeks or sometimes months. That is counter to the recommendations from Federation of Canadian Municipalities and a whole host of others where the gold standard is to have addiction treatment on demand. So when you need it, it is there for you, not 6 months later. So to your question, there might be some addiction treatment kind of component, but we're concerned about capacity in the entire system, and I think the AG's report sheds some light on that. We've got a long way to go, and when you think about the prevalence of addiction across Ontario, the scale is now so massive that it's doubtful whether we'll ever get to addiction treatment on demand. It's such a different standard compared to coming into the hospital with a burst appendix. The physician or the nurse doesn't say, well, you have a burst appendix, come back and see me in 6 months, and in the meantime, don't act like you have a burst appendix. But that's what we do to people who are seeking addiction treatment help.
And just this audit that's being requested, when you say we're requesting it, who is? I presume you, or is it the group, and who are you requesting it from?
It's the Drug Strategy Network of Ontario, and we want to see the analysis. We think it'll be net negative for all taxpayers, whether you're using substances or not. But that analysis simply hasn't been done to date, and ideally it would come, in advance of a major policy decision. That hasn't happened, of course.
You're requesting this of the Ontario Auditor General?
Correct. Yeah.
Okay.
Thank you.
Thanks.
Thank you.